So, Dr. Stock, you've gotten into airway, and that's not really a common understood term for dentistry. Can you tell me a little bit about what is airway dentistry?
So airway dentistry has to do with the size of your mouth and your throat and your breathing. So it's a relatively up and coming field over the last 10, 15 years. It's a very important piece of the whole puzzle. So it's not just your teeth and how they fit together, but it's the shape of your jaw, and that ties into breathing and sleeping.
Tell me a little bit about what the symptoms are that I might be experiencing.
So some of the symptoms you might be experiencing are snoring, disturbed sleep, feeling tired, fatigue.
What do you do to check out to see if it is in fact an airway situation?
So the first thing we do actually is do a home test, a sleep test. And it's very simple. You have a ring and you put it on at night and it measures everything. And from that, it gives the data that we can tell whether you have some sleep apnea going on or if everything is normal and it's not a sleep issue.
So it's literally a ring that you wear?
It's literally a ring that you wear.
1 night, 2 nights?
I like to have, a lot of places just do 1 night, but I like to have actually 3 nights. Now you might have 1 bad night, and so doing 3 nights is going to give the information to make sure that we're getting the right data.
Right, and I guess with 3 nights you've got a bigger average because 1 might be a great night, and
Totally.
It's not adequately representative of how things are. No, I like that. So you do your analysis. I've worn the ring. It's 3 nights. You find out I have an airway situation. What does that mean?
You're going to be diagnosed with sleep apnea, and depending on the severity, if you're really severe, actually, might be sending you right to the sleep doctor to get a CPAP. And then if you have mild to moderate, we have options of treating it. So we'll do an appliance that the whole idea is expanding your arch to get the airway as wide as possible so that your tongue goes up to the roof of your mouth and that you are a nose breather. Because as you breathe through your nose, the air is warmed, humidified, nitrous oxide is added to it. The oxygen going into your bloodstream is better than mouth breathing.
So the CPAP, so you said if it's a very severe situation of sleep apnea, I might end up in one of those devices.
A CPAP, because if you have severe sleep apnea, that's dangerous. It needs to be treated. You can't, because the sleep appliances that we use might take 9 months, 18 months. It's basically an emergency situation. You need that CPAP. Now you can have that CPAP and then start appliance therapy to get that expansion. So maybe you don't need the CPAP and you just need an oral appliance, or your episodes are less.
I see. So if it was severe, you're making sure that I'm not falling asleep and staying asleep, because
Exactly.
From what I understand, in sleep apnea, you know, in some cases, people actually stop breathing for some time.
Yes, that's true.
That's, of course, what your device, your little measuring device on the ring is going to tell you. 3 days worth of that, and you'll see some
Right.
indications.
So in addition to the sleep ring, we do cone beam, which is the 3D image of basically your entire head, and it's going to measure the airway so that we know what we start with and what we end with. And we need that information too to be able to do a full diagnosis.
So if it's severe, I go onto a CPAP, then concurrently, I'm also doing this airway handling with the device.
Yes.
I might not need to be in that CPAP forever.
That is the goal.
Yes.
That is the goal. I can't promise it, but it's very promising.
Tell me, what is CPAP? I mean, I understand CPAP. What does that even mean?
So it's a continuous flow of air that's being pumped through your throat so that you can breathe. I think that they have improved over the years, but most people don't use them or they like them. And so if they're not using it, their life's in jeopardy.
If I have sleep apnea and it's a severe situation, what might be some of the manifestation symptoms, things, results, possibilities? Tell me a little bit about that.
What you might feel actually or know of, if you don't have a significant other, you may not know that you're snoring. If you have a significant other, they probably will tell you snore. So if you're snoring really loudly, you probably have a fairly severe sleep apnea issue versus light snoring. So if your wife is not wanting to sleep in the same room, or your kids are like Dad's so loud, you probably have a real issue going on.
Like if I'm embarrassing their friends and they don't invite any friends over.
Totally. Totally. So you may feel fatigued. You just feel like you're not sleeping, you're tossing, you're turning, you're not breathing right, and you just don't really know why. And it's because you're probably, over time, you're breathing through your mouth at night, and that's why you're getting the snoring sound, and you're not having the adequate air so that you get a restful night of sleep. And you really need that restorative sleep to be able to function. So daytime symptoms might be that, you need a lot of coffee, that you fall asleep in the car as the passenger. So, you're exhausted.
Tell me a little bit about the device and what you can offer. Say I'm not severe and I'm not on CPAP, or say I am on CPAP, but I want to do something that's more long-term and hope to getting off of the CPAP. Tell me a little bit about what it is you do and what you can offer.
I actually offer two approaches. One is actually Invisalign. So I've been doing Invisalign for over 20 years, and I've always, right from the beginning, wanted to expand, not retract. Just coincidentally, by that philosophy, I've actually helped a lot of my patients. The problem with Invisalign is I can only expand so much.
I see.
So if someone doesn't need that much expansion, we could try doing it with Invisalign. If they need more expansion, then we would do the Vivos DNA appliance. It almost looks like a retainer. You're able to stimulate the stem cells in the palatal suture, and we can get significant expansion. So like with Invisalign, I might be able to expand 2 millimeters, maybe 3. With the Vivos, I might get 7 or 8 millimeters. So some patients need additional treatment, and some patients just need the Vivos treatment. And then of course, we're monitoring you with the sleep ring periodically to make sure we're seeing some improvement.
How long would that take? I know Invisalign also varies. For Vivos, how long does that take?
It depends on patient compliance. Just like Invisalign, if you're not wearing the trays, you're not going to get the movement. Invisalign, you're wearing it about 22 hours a day. With traditional braces, it's 24 hours a day, and the teeth, it's continuous force. With Invisalign, you're getting some not so continuous force because you are taking it out, you're eating. With the Vivos appliance, actually, you're not supposed to wear it 24 hours a day or 22 hours. You're wearing it 12 to 16 hours. Okay. So we want to stop, and you want things to go a little bit and come back, and that's how we stimulate the growth. You would do it probably, you would try to get from 7 p.m. to 7 a.m. and then try to figure out a few more hours during the day. It really depends on the patient. You're being monitored closely, and then, some patients are 9 months, some patients might take 1.5 years. It really depends.
Yep. Still, I guess in the grand scheme of things, if this has been a lifelong issue, to take, 9 months to 1.5 years.
Right. It goes by quickly.
Yeah.